Okay, hi everyone, I'm Visanee from Bangkok, Thailand. The topic I'm going to talk today is about the uses of laser in children glaucoma. Oops, sorry, it does not moving. Okay then. Well, I have no financial I don't have financial disclosure. Childhood glaucoma has been classified into many, and recently what is that? Okay, well, the childhood glaucoma has been recently classified, newly classified into many forms, such as glaucoma associated with other diseases, ocular or systemic diseases, primary congenital, and the glaucoma suspect, and the JOHG sort of. So, but the prevalence depends on, geographical areas in sometimes. So let me show you some characteristics of pediatric glaucoma in our institutes. After 10 years data collection, more than 400 patients, we found that more than 50% of us shows in terms of the secondary glaucoma rather than primary congenital, which is the primary congenital just only 20%, and the glaucoma suspect, because of that, they are referred to as just only 20% as well. And when you compare our studies with other studies from other areas of the world, we found that the primary congenital in our studies are much lower than other studies. Pediatric glaucoma, as mentioned earlier, is a surgical case, of course. The angle surgery is the procedure of choice, but particularly in primary congenital. Otherwise, we have to go on with trabeculectomy or the GDD in the selected cases. Anyway, the drawback of the types of the penetrating glaucoma surgery in young children is the risk of devastating complications, particularly the choroidal diffusion or subchoroidal hemorrhage in cases that particularly for the risk of hypertony. And cases that need multiple post-op examinations, of course, those with surgical interventions, post-op interventions is always needed, and they need to be under the general anesthesia. And of course, we will put our little children to the risk of anesthesia-related complication too. So that's why some clinicians prefer not to intervene at all in cases with a poor prognosis or the eyes anomalies that significantly increase the risk of surgical complications. Laser is another treatment modality to glaucoma, and has about how well it works in children glaucoma. There are diode-TCP, endoscopic CP, and recently launched the micropulse TCP. So let's take a look at it. The diode-TCP is something that we find that are very, least invasive, and no, it's not that least, but because it can cause a painful eye during the procedure. So our patients need to be under the anesthesia again. But the outcome of this, from the study, the diode-TCP can decrease the IOP in the little eye comes down to 33%. But most of the time, they need to be retreated more than once. The overall success rate, whether in younger or older subgroups, did not difference, and the overall success was about just only 50%. This is another study that shows that the IOP can be sustained after the laser at the favorable level up to 60% over 1 year after the laser. But they also show that the cases up to 13%, that is no effect at all. And particularly if you look at the survival curve after 24 months or 2 years after the laser, this effectiveness has been declined drastically. And again, if you look at this study, they show the type of the aphakic glaucoma can do better with the laser treatment than other types of the congenital glaucoma. However, this study also show again about 13% that fails to control after 6 months, before 6 months after the surgery, after the laser surgery. The ECP is something that can help us on the direct visualization of the steady processes. And how's about that success rate. It's just only 53% in this study. This study was done in aphakic and pseudophakic eye, and just like other studies, after 500 days post laser, you can see it's nearly 2 years, just only a year and a half, that the effectiveness of the laser declined drastically. And when comparison of the effectiveness of the transcranial CP and the ECP, it was found that if you increase the number of procedures more than 2, perhaps you can have the final success rate, increase up to 60 to nearly 70%, and the reduction in IOP can finally up to 30% in both procedures. The MicroPulse TCP is recently launched, and it works by decrease the production of the aqueous and probably enhance the GVO scleral outflow. In this study, they recruited the patients with the adult patients and pediatric patients all together, and they found that in the adult patients might do better with the MicroPulse TCP rather than in the pediatric eyes. But please be noted that 8 out of 9 of childhood glaucoma here were anomalies associated. Another study of the MicroPulse was done in children under 16 years of age with the recurrent glaucoma. Half of them was diagnosed as a primary congenital, and these cases followed by 15 months after the surgery, and they found that the mean IOP dropped significantly to nearly 40%. Qualified success is about 60%, not as much different from others, and yes, most of the cases required second treatment. Another thing that we have to be in mind is the SLT, because SLT is very least invasive. Can it be done in the children that old enough to comply with the physician instructions? I think they can do it, and some of the case reports shows that the SLT can, give the favorable results in these reports, just like 4 to 5 weeks after the laser done. But anyway, please be notified again. The gonioscopic examination reviewed grade 4 in both cases with rare pigments and rare PAS. We found the same thing in our cases with the 8-year-old boy who was diagnosed as a steroid-induced glaucoma after a long run of the steroid eye drop for his severe allergic conjunctivitis. He was referred to us with a uncontrolled IOP in his right eye, even though with the MTMT, and was referred for the surgical intervention consideration. But after we have discussed with himself and his mother in depth and at length, finally, the SL10 was done in his right eye. And interestingly, at 1 month, the IOP dropped down to 8 millimeter mercury, which is, I don't think it's just only because we quit the steroids, it should be the effect of the laser rather than that. And later on, the medication was gradually reduced, but because of his advance into his right eye, the advanced glaucoma in his right eye, we can't, give all those medication away, which is fix him with a fixed COM. And after the 10 years passed by, any other intervention had not been done again, and the IOP can be well controlled. OCT, we have showed no progression at all. So if there are any laser treatment in children glaucoma, I would say that there is, of course, but the consideration must be done whether you would do it after the multiple surgery failure, or take it in consideration if for the primary, if the cases at a poor prognosis and the eye anomalies that high risk of hypotony or sort of things. So in summary, the laser treatment in childhood glaucoma can achieve up to 30% of IOP reduction. The aphakic eye might be more responsive than other types. Most cases almost always need more than one treatment. The success of the IOP control can be favorable up to 2 years, but after that, it will be declining drastically. SLT might be beneficial in juvenile glaucoma with normal appearing angle. And to my experience, I think trabecular dysgenesis appearance might not be a good candidate for SLT. So that's all for now. And thank you very much for your kind attention.